everyone, and welcome back to my channel. This is Cloudy Bell. Right, it's been quite a while. I hope everyone is doing good. I hope you're faring okay, still keeping safe. We're thinking this COVID is all gone, but it's still really out there. Okay, so all right. So let's just talk about incontinence or loose vagina. Okay, so two things. So it's basically how to tighten your pelvic floor, or how to tighten your vagina, or how to prevent incontinence. Right, so first of all, let's start with incontinence. There are things that can, usually for females, even for males as well. You notice that you're having incontinence. Maybe when you cough, you notice that you pee on yourself, or when you laugh or something, you're releasing some peeing or some urine. All right, so that's called incontinence, and that can be classified under stress incontinence or urge incontinence. So usually so many things may have caused that to start happening, that you're losing your bowel control, you're losing the muscles, your pelvic muscles are really not that tight enough to prevent that from the incontinence from happening. So there is something that you can do. So keeping that right there. The other part will be someone that have given to birth, like some women that are experiencing loose vagina. They are not really tight in there anymore. Maybe due to stress again, maybe due to trauma, or maybe due to childbirth. All right, I'm really at work, okay guys, still. All right, so if you want to tighten your vagina or your pelvic area or your perineal area, so you can do, which is called kegel exercise. It doesn't really take you much. You're not taking any medication. It's just an exercise that you practice. I know some of you may have heard about it, but probably you don't really know how to do it or what it does actually. So kegel exercise helps to tighten the vaginal area, tighten the pelvic floor, tighten your perineal area, so that you're able to control your urine and stop having that stress incontinence or any incontinence at all, or to make that muscle to be tightened up again, contracts, so that you don't you feel more tight and enjoy your sex, or maybe stop incontinence. It's really embarrassing too. All right, so the way you practice this is by kind of like, when you're peeing, try to hold your urine for like 2 seconds to 5 seconds, depending on how you're able to start. Some people can really start from 5 seconds at a time. You can practice this as much as you can, maybe 10 times with each set. So either when you're peeing, or you pretend to hold your urine, like when you're peeing, amidst the urinating time, you hold your urine. So that's what it feels like to practice the kegel. Or you can see it as sucking, how you suck with your mouth with a straw. You suck through the straw with your mouth. So you can practice that using your vagina. So it's like sucking with your vagina basically, or sucking with your private area. The men can practice this as well if they're having a incontinence. So men does really experience incontinence because of loose muscle in their private area. So men and women can practice this as well. So just pretend like you're peeing and you're holding your urine. Hold it for 1, 2, 3, 4, 5 seconds. Release. Hold it again. You can really be doing this anywhere, in the car, in the plane, while in the bed, on the couch, anywhere, even while walking. You can really be practicing this, and nobody can even tell you're really tightening up your perineal area. So just hold. It's like sucking. Suck with your vagina, suck with your private area. Hold it as much as you can and release it. Suck, hold this as much as you can and release it. Okay, you really feel it. Sometimes you can really or if you want more effective way of doing this is like getting your chest out and pushing back your bum backwards while you're sucking with your private area. You will feel it effective. Okay, practice this as much as you can and you see how tight you are. Okay, and if you're doing this because of incontinence, you really notice some changes over time. It's not really like a magic fixation or something, so you really have to be consistent. Okay, give it some time, and you don't really, this is like a non-surgical approach to vaginal tightening or pelvic floor tightening. All right, I hope I make sense. If you have any question, please drop your your question down below. And I hope you enjoy tightening and sucking. It's really not funny, but seriously guys, we need to be sweet and tight down there. For guys too, you need to be tight. You don't want to be when wearing diaper when you're still so young. At any age you can actually practice this. Okay, it's not just for particular people. Even the people that don't feel like they are too loose, once you've had that baby far from there, right after pregnancy and all that, you can still keep practicing it to make you more tighter. You can even do this while you're having sex or anything.